If you own one, you need to know how to look after it, and a lot of guys don't. So in this video, I'm going to tell you everything you need to know about how to care for your penis. Stick around. Hi guys, I'm Dr. Lane from Adelaide, South Australia, coming to you with fun and factual health education. Now in this video, I want to talk to you about how to care for your penis. This is a question I get asked a lot and it's quite topical at the moment. What do you need to do to look after yourself, protect yourself from STIs, and also just have a healthy sex life? So here are 5 things I recommend. Firstly, keep it clean, but not too clean. That's right, you do need to wash down there, but don't use soap. Everyday soap is actually quite harsh on the skin and it can dry out the skin on the penis, which is already very sensitive. So when you wash, I would recommend either just warm water in the shower, or you can use something like a Sorbolene QV soap alternative. These are really good because they're more pH neutral, so they don't dry out the skin and they won't reduce sensitivity. Number 2, maintain healthy erections. Every time the penis gets erect, it allows blood to flow through the tissue. So it's actually good to have sex or to masturbate on a semi-regular basis. But the other thing to look out for is erectile dysfunction. A lot of guys suffer with this, but they don't go to the doctor because they're too embarrassed. Don't leave this one. If you notice you're having trouble keeping an erection during sex or masturbation, and particularly if you're noticing that you're not getting erections in the morning like you once used to, go and see your doctor to work out the next steps. Number 3, protect it. Now, obviously not every couple needs to use condoms, particularly if they're only having sex with each other. But if you are having sex with multiple partners, it's always a good idea to use a condom. This is going to be your best way of preventing any fluid transfer between people, and most of the time, infections are in the fluids. Number 4, have a feel and get to know what's normal. Now rest assured, in most cases, if you do find something down there like a lump or a bump, it will probably be nothing to worry about. But unless you check there regularly, you're not going to notice if there's a change. It's exactly the same as doing a skin check so that you know if you get new moles. My advice, get to know what your genitals look like, feel like, and don't be embarrassed to go and ask someone for help if you're worried. And number 5, lifestyle factors. People don't think about this one, but it's really true. If you smoke, if you are eating really poorly, or if you're not exercising, you are at risk of other conditions, things like diabetes or vascular disease. These will have an impact on your sexual health. For example, people with diabetes are more likely to get yeast infections such as balanitis. And people with vascular disease are more likely to have problems with erectile dysfunction in later life. Okay, so if you haven't checked out my channel, please do so. I'm putting a link to another video on the screen right now. And if you like this video, please hit the like button. Stay healthy, guys. I'll see you soon.